Good day, dear friends. Currently, the number of patients taking anticoagulants is increasing. Doctors prescribe them for venous thrombosis, pulmonary artery thromboembolism, atrial fibrillation, and after the installation of a mechanical heart valve. To date, their prescription is also associated with the new coronavirus infection. As practice shows, the most popular in this regard is Eliquis. Today, we will talk about 5 important mistakes in prescribing this drug, which can lead to serious complications and in some cases pose a threat to the life of each of us. So the first mistake in prescribing Eliquis is related to the violation of the duration of the drug intake. It should be prescribed twice a day with a 12-hour interval. Analyzing the histories of diseases of patients discharged from the hospital, situations are often encountered in the recommendations when Eliquis is prescribed once a day. This is a serious mistake that does not completely eliminate the risk of developing thrombosis and complications associated with them. The second, no less significant mistake in prescribing Eliquis is the absence of an assessment of the functional state. Liver. For this purpose, it is necessary to make a coagulogram, assess the level of alanine aminotransferase, aspartate aminotransferase, gamma-glutamyl transpeptidase, albumin of the filtrate, bilirubin, its fractions, alkaline phosphatase. These analyses must necessarily be carried out and properly assessed before and after the appointment of Eliquis. This drug is contraindicated in diseases accompanied by a disorder in the blood clotting system and a clinically significant risk of bleeding in patients with severe liver insufficiency. The third mistake in treating with Eliquis is related to the fact that in a number of cases it is simply straightforward. They forget to cancel it no less than 48 hours before a planned operation or invasive procedure associated with a significant risk of bleeding. Moreover, in all cases, the drug is not administered, and in the event of severe bleeding. This is the fourth mistake. Most often in this situation, you have to deal with 2 situations. Either the source of hidden bleeding is not diagnosed in time. For example, a general blood analysis is not conducted dynamically when there is an unexpected drop in arterial pressure numbers, or there is an underestimation of the severity of bleeding when the doctor, instead of the necessity of cancelling the drug, limits himself to reducing its dose, which undoubtedly creates a threat to the patient's life. The fifth mistake in prescribing Eliquis is made when transferring a patient from warfarin to Eliquis and vice versa. And both actions should be carried out under the control of international normalized ratio. This is the international normalized ratio, an indicator that demonstrates the degree of blood thinning under the influence of an anticoagulant, specifically the drug Eliquis. So, a patient can be switched from warfarin to Eliquis if the international normalized ratio is below 2 units, and when transitioning from Eliquis to warfarin therapy, it is necessary to continue taking Eliquis for 48 hours after the first dose of warfarin. I draw your attention to this. And also, due to the high risk of bleeding, simultaneous intake of Eliquis with any other anticoagulants, except for special clinical situations, is simply contraindicated. In addition to all of the above, I should also mention the fact that Eliquis cannot be combined with ketoconazole and similar drugs, as this doubles the concentration of Eliquis in the blood plasma, which is also fraught with the development of life-threatening bleeding. In this situation, everything depends on the dose of the anticoagulant taken by the patient. Stay healthy, dear friends, and until we meet again,